into the upper arm or upper thigh if the client's limbs have been inactive or if they are paralyzed. And for children, you will adjust the size of both the needle and the syringe according to the child's size and the amount of medication to be injected. If the solution is viscous, you will need a larger needle, such as a 20 gauge. Then again, if you are injecting into the deltoid muscle, you'll choose a smaller gauge needle, such as a 23 or 25. Obviously, for larger volumes of medication, you'll choose a larger volume syringe, and for smaller volumes, a smaller syringe. And for some IM injections, you'll use single-dose, pre-filled syringes. Your next consideration is the angle of insertion. For IM injections, you will insert the needle at a 90-degree angle, since the needle must penetrate epidermal, dermal, subcutaneous, and muscle tissues. Probably the most significant factor in IM injection technique is site selection. You must be certain that the site you choose is safe, that is, that it is located away from large blood vessels, bones, and nerves. And even when you choose a safe site, you must also make sure that it is free of inflammation, edema, irritation, moles, birthmarks, scar tissue, abscesses, and lesions of any kind. The most common sites used for IM injections are the ventrogluteal, vastus lateralis, and deltoid areas. Let's review each one briefly. The ventrogluteal site is the preferred site for intramuscular injections for adults and children over 7 months of age. The underlying muscles are normally well developed, plus it is safe and less painful than other sites. The ventrogluteal site can be accessed with the client in various positions, but it is easiest to identify with the client in a side-lying position with knees bent and raised slightly toward the chest. This makes the greater trochanter protrude, which is helpful in establishing landmarks. To locate the site, the nurse places the heel of her hand on the greater trochanter with her fingers pointing toward the client's head. With her index finger on the client's anterior superior iliac spine, she stretches her middle finger toward the client's buttocks, palpating the crest of the ilium when pressing below it. The middle of the triangle formed by her index and middle fingers and the client's iliac crest is the appropriate injection site. Another site is the vastus lateralis, located on the anterior lateral portion of the thigh. This well-developed muscle is typically used for adults as well as infants and children under 3 years of age. It is relatively safe because that area does not contain any large blood vessels or nerves. To locate the vastus lateralis site in an adult, the nurse has the client assume a sitting position, although he could also lie supine. The nurse divides the area on the thigh between the greater trochanter and the lateral femoral condyle into thirds. The middle third is the appropriate injection site. Another choice is the deltoid site, located on the lateral part of the upper arm between the acromion process and the top of the axilla. It is a convenient site to use since clients do not have to remove their clothing. However, it can only accommodate up to 1 milliliter of fluid, plus the site is close to the radial and brachial arteries and nerves. To identify the deltoid site, the nurse finds the acromion process, then plans to inject the needle about 2 inches, that's about 5 centimeters, below that landmark. If your client requires multiple or frequent IM injections, be sure to rotate injection sites. Mark the date, time, and site of the injection on the medication administration record, or on an injection rotation chart. An orderly rotation of injections speeds medication absorption, lessens discomfort, and helps prevent tissue damage. Assess this site for inflammation, swelling, erythema, or tissue damage from previous injections. Proper injection technique is another consideration to ensure medication is deposited deep into muscle tissue. Medication leakage can damage upper tissue layers and slow absorption rates. To prevent this complication, one needle should be used to draw up the medication, then replaced with the proper size needle for the actual injection. The Z-Track method is recommended for administering the injection. This allows upper tissue layers to seal medication into the muscle by displacing the needle tract as the needle is being withdrawn. Before administering an intramuscular injection, ask the client about any drug allergies. Review information about the medication you are going to administer, including the action of the drug and any side effects, contraindications, or potential adverse reactions, and share the appropriate information with the client. Next, you'll evaluate the client's age, weight, degree of muscle development, and the condition of the tissue you plan to inject. Also, evaluate the client's ability to cooperate during the injection and make sure others are available to help as needed. Before we proceed with a demonstration of an IM injection, remember that all parenteral injections are invasive procedures, so you must keep infection control in mind whenever you give an injection. To prevent infection, follow these basic rules. If the client's skin is noticeably soiled, wash it first. Wash your hands thoroughly before preparing the injection. Withdraw medication immediately after opening an ampule or vial. Wear gloves because contact with blood is a possibility whenever you administer an injection. Do not let the needle touch unsterile surfaces such as the outer edges of the ampule, the outer surface of the needle cap, or your work surface. Do not touch the long part of the plunger or the inner part of the barrel. Keep the syringe tip covered with a cap or needle. With an antiseptic swab or pad, use friction while cleaning the injection site in a circular motion. Cleanse from the center of the site and move outward. And promptly discard any items that become contaminated and begin again with sterile equipment. Now let's go ahead and demonstrate an intramuscular injection of an analgesic to an adult client in the ventrogluteal site. We'll assume the nurse has drawn up the medication and changed to the appropriate needle size and syringe, and has verified the client's identity, screened the client for allergies, and explained the procedure, and has checked the medication record for the appropriate drug, dose, route, and time. The nurse cross-checks the medication's label carefully with the medication record and examines the vial to check the expiration date and to make sure the contents are not inappropriately discolored or thickened and that no sediment has formed. She then assembles her equipment. She will need the medication vial, needles and syringe, antiseptic pads and gloves. The nurse washes her hands, then opens the vial and withdraws the appropriate amount of medication into the syringe and changes to the selected injection needle. She provides privacy, then positions the client on the left side with knees bent. Next, the nurse identifies the right ventrogluteal site and drapes appropriately. The nurse puts on clean gloves, then cleans the selected site with an antiseptic pad according to agency policy. She starts at the center of the site, rotating in a widening circle to about 2 inches or 5 centimeters. She then allows the site to air dry and positions the swab on the client's skin above the intended site. She removes the needle cover and uses her non-dominant hand to displace the upper tissue layer at the injection site. Then, using her dominant hand, she holds the syringe as though it were a dart and injects the needle quickly at a 90-degree angle and uses her non-dominant hand to stabilize the lower end of the syringe. She aspirates for blood by pulling the plunger back with her dominant hand. Seeing no blood return, she pushes slowly and steadily on the plunger to inject the medication. She counts to 10, allowing the medication to begin absorption. She begins to withdraw the needle slightly and releases the tissue and needle together. She applies gentle pressure at their site, then removes it and observes the site for bleeding. During and immediately after administration of any medication by injection, take precautions to avoid needle stick injuries. For example, never recap a used needle. If available, use any built-in safety features as the manufacturer directs. Discard used needles and other sharps in clearly marked puncture and leak-proof containers according to agency policy. Never place a used needle in a wastebasket, in your pocket, or at a client's bedside. Also, following an injection, assess your client carefully for any adverse effects. Medications given IM are absorbed rapidly and can produce such effects quickly. Watch for behavioral changes that could be a result